awareness.
I got another rhyme, another rhythm for y'all to listen. I'm never quitting on my mission. Roll with what I'm giving. Got some ambition, this new edition, feeling position. Looking at the board in myself and feeling missing. Better watch me where you going. They go in the right direction. In the moment, you stressing, but you gon' be counting blessings. And I know that for certain. Keep on working. Just hate this for me, cause your final version. I'm never gonna give up, fall down. I just gotta get up, hey.
You're listening to the Tom Ficklin Show on WNHHLP 103.5 FM, your home for community radio.
And as excited as I really am, good morning, everybody. I would just like to welcome you to the Tom Ficklin Show at 103.5 FM, WNHH. You are here with myself, Bernard Macklin. I'll call myself One Time with Bernard Macklin, representing CARE at Southern Connecticut State University, Department of Health and Human Services. Who I have on the call with me today is two dynamic individuals. And we're just going to begin talking to you a little bit about COVID versus our children doesn't mix. And we just want people to understand how important, as we look at the rising infection rate of COVID amongst our babies with this new variant, the Omicron variant. I just wanted to give you two perspectives today, one from a public health perspective, and then the other from the medical perspective. I have on one side, Jackson Higginbottom, which is the coordinator for communications with CARE. And I have my dynamic friend who I've befriended over the last year in working directly with her, and Dr. Leslie Sue. And I'm just so happy to have the both of you here today to help people understand how important it is to get vaccinated and how important it is for us to take better care of our children. I know people are real sensitive when you begin to talk about their babies, either on the hesitant side or actually on the actually vaccinated side. Either way, it's a very hot topic. So I asked Jackson Higginbottom to come in and speak from basically a public health perspective, and I asked my good friend Leslie Sue to come, who is a pediatrician with Fairhaven Health Center, as well as the leading, when I say leading person when it comes to vaccinating this community through community health care services provided through Yale School of Medicine. I'm so happy to have the both of them here with us today, and I celebrate you both. If you can just come here real quickly and just tell us, Leslie, about yourself and kind of the work that you all are doing in the community right now in actually both places.
Thank you, Bernard. And thank you again for welcoming me back to the Tom Ficklin Show. And it's always a pleasure to be here. And good morning to Jackson and to New Haven. Since the beginning of the pandemic, I have been looking for responsive solutions to barriers the community might face in receiving healthcare. My first initiative, as some of you may know, is that I developed a mobile health service to see postpartum mothers and newborn babies in the community, coming right up to the doorstep with a nurse and a whole team of people who can provide services and see babies safely and the mom safely, and do some linkage to primary care and navigate social needs and link with community resources. Because if you remember, in the beginning of the pandemic, it was very difficult for people to get out, and we did not want people to travel. And in many cases, we still don't want people to travel by public transportation or in Uber cars with people driving that they don't know well, may not know their virus status. So that work continues. But more recently, I'd say over the past 14, 15 months, I've been leading efforts to vaccinate New Haven, first against influenza, when we had the influenza vaccine campaigns last fall, not this past fall, but the fall of 2020. And then more recently, since I'd say March, we've been out in the community vaccinating people in all kinds of locations against COVID vaccine. And most recently, we've actually been able to start vaccinating children, which has been a very helpful and necessary part of our mobile vaccination efforts.
Thank you. Beautiful. Actually, what makes it more exciting is I had a chance to ride in the van with the when they went out to see women with babies, and it was intense. I had to go. I heard about it, and I had to go out with their provider, and I had a wonderful time. And I love the work that they're doing out in the community, and I'm so glad that she mentioned that in her introduction. My good friend, I met Jackson for the first time actually earlier this year. Last year. Now we're in the new year, so earlier last year, and he took over our communications department here at CARE. And one thing that I love about Jackson is his mind, the way that he thinks, and some of the ideas that he's come up with helping us to better serve this community. Mr. Higginbottom, if you could just come in and just tell us a little bit about the work you're doing here at CARE and at Yale, just so people can get to know you a little better.
Thanks, Bernard. Hi, everyone. I'm Jackson Higginbottom. I graduated with my master's in public health and social and behavioral sciences, and I've been working with CARE for the last few years in New Haven in the community, doing work with various health programs and projects, working with community members. More recently, over the last year and a half, 2 years, I've been really focused on COVID and flu communications and working with Bernard and Leslie and our other community partners and the health department to really get information out into the community about flu and about COVID, and to reduce as many barriers as possible to accessing the vaccines and feeling confident in the vaccines, and making sure that you know why you're getting the vaccine, know why you want to get the vaccine, and your reasons behind it, and empower you with that information to go and get the vaccine to protect you and those around you.
And believe me, I've seen him on both sides of the fence. I'm trying to tell you, I'm really proud of the work that he's doing. And sometimes we miss, because you never met some of the people that are actually working in the community to help you. Tom has given us the ability to come on his call, because he has a great following, to actually help you to see the people that are working for you, not against you. And a lot of the hesitation is because you are not confident. You're not feeling good about feelings about the government. You don't really care about the vaccines due to other issues that are outside of the vaccine or getting vaccinated that are preventing you. Well, I actually brought Leslie on today because I really want to make this thing here and put this out to the community, how important it is to get your children vaccinated. Not to say that we want anything to happen to them or they're going to die. A lot of times when I worked in the community, a lot of people just didn't want to take the flu vaccine because they didn't want to get sick. So this is one of those, the Omicron variant is one of those things that will make you sick. I mean, you can get sick, so preventing you from getting sick. I don't like using the word die because people get afraid of hearing that term, but possibly those things can possibly happen with any variant with COVID. So I brought Leslie, a credible medical professional, a doctor, a pediatrician, one of the best in the city. I know it because I work directly with her. So I've seen her work, so I know she knows what she's doing. So Leslie, this thing is driving me nuts. I mean, as working from a coordinated outreach perspective, getting people to understand the message is where I struggle. And what would you say to the community and women with children and fathers and mothers with babies as it relates to getting your children 5 through 17 vaccinated? What would you say to these families?
Sometimes I find, Bernard, and let me know if this is on point for the purpose of this morning's discussion, I find it helpful to take a step back and send a message out about how these vaccines actually work and how they affect our bodies. Because if we just talk about vaccines and lump them in with every other vaccine, it can leave doubt in our minds, especially since this one is a new one, and there's nothing we can do about that. Although I should actually qualify what I said. This vaccine, while it's new in use, the technology has been in existence for well over 10 years. So if you just indulge me for a second, I want to talk about the vaccine.
Please.
People thought the vaccine was rushed. It was experimental. There was confusion about the term EUA, emergency use authorization, which was the designation that the FDA, our Federal Drug Administration agency, attributed to the rollout of this vaccine. And that was really mostly because of some logistical issues in getting this vaccine out of development and into people's arms as quickly as possible because of the drastic nature of this pandemic. But the technology for this vaccine has been looked into and under study for many, many, many years, and repeatedly has been demonstrated to be a safe and effective way to vaccinate people against various diseases. There are earlier versions of this coronavirus that we have known about that for which this vaccine was put into development. But because those earlier versions did not wreak the same kind of widespread death and destruction, if you will, that this particular version of the coronavirus, the SARS-CoV-2 virus, there was not much interest from an economic point of view to put it into production and sell it, if you will, to doctors' offices. Drug companies are motivated by profit, by and large. I actually should take that back too. They are motivated to develop therapeutics and immunizations that are going to be current and relevant and be not profitable in a way that make them money, but profitable in a way that they can stay in business to operate. And it wasn't until we had this pandemic that this technology category. So what technology am I talking about? I'm talking about the mRNA technology. mRNA stands for messenger RNA. And what mRNA does is take instructions from our DNA and delivers those instructions to our cells to do something. So for example, in our DNA, we've all heard about our DNA. Bernard, your DNA might tell you, your body, to make your eyes brown. My DNA told my body to make my hair long and straight, my eyes green. But how do you get from those instructions to actually green or brown eyes? Well, it's through a process of delivering the instructions to mRNA or through mRNA, which serves as a little messenger, and it drives those. It's basically picking up the instructions from the architect, driving them to the construction site, which is cells, and saying, here you go, make Bernard's eyes brown, make Leslie's eyes green. In the case of the coronavirus, we've all seen that ball, the image of the graphic of the virus with all those little spikes on it. In the case of the coronavirus, mRNA is picking up the instructions from DNA. Well, but except this time we're giving it the instructions. The mRNA has the instructions to do one thing and one thing only: make spike protein. So we get that mRNA instructions for spike protein put in our arm, and it drives those instructions to our bodies and to our cells that makes one thing and one thing only: spike protein. Well, why is that important? Well, now the body is putting out all this spike protein that it just learned how to make because of the instructions it got from the mRNA vaccine. And our immune system looks at these spike proteins, these little sticks, these microscopic sticks are floating around. They can't make us sick. They're not attached to a virus, just floating around in our bodies. Eventually they're going to get degraded and we're going to waste them out of our bodies. But before we do that, the immune system says, yo, what's this? These are sticks. I don't normally have sticks in my body, spike proteins in my body. I think I'm going to attack them. And it makes an immune response through antibodies. Eventually, those spike proteins go away, but what stays are those antibodies, which become a part of our immune system. Then a month later, 2 months later, maybe 6 months later, we get for real coronavirus, the ball with the spikes, which could hurt us and cause harm because now it's a live virus. And our antibodies say, I know what you are. I'm going to attack you because I know what those spike proteins are. And I've prepared myself to defend the body against those spike proteins. And then it's like a video game. They attach to the virus with the spike proteins, and there's a neutralization event, and boom, away goes the virus. That's how that vaccine works. So just to be clear, the vaccine cannot cause illness. And by the way, neither can the flu vaccine directly. It cannot make us sick. It doesn't contain anything biologically active that can make us sick. So why do people sometimes feel well after getting the flu vaccine or getting the COVID vaccine? Well, it's because it's that immune response. When that immune response is doing its thing, it kicks off some chemicals. It gives us a little fever, might make our body ache. We look at that as a good sign. It means that it's a signal of a healthy immune system, a robust immune system that it's preparing its army of antibodies to fight the virus, whether it's flu virus or in this case, a coronavirus, in real time when we get infected with the virus. In terms of children, it seems, are doing extremely well with this vaccine. The drug companies were able to isolate and test the smallest effective dose. I can't remember offhand. I think it's about half, 2/3 or a half of the dose of an adult dose that will mount the same protective immune defense against the coronavirus. And we're seeing virtually no side effects, the vaccine itself, other than the usual pain at the injection site. We're not even hearing so much about all the aches and pains that older people get. We're not really sure why, and maybe people are hearing about them, but I certainly haven't. The kids are flying with this vaccine and doing great. Why is it important? I'm sure there's many listeners on this call who've heard that the current version of the Omicron virus doesn't cause as severe and devastating disease as the earlier versions of the coronavirus. Well, that's true by and large, but it's not completely true. And there are still older folks and younger folks who are getting Omicron and becoming quite ill. It's not the majority, but it is happening. And children are now the largest reservoir or pool, if you will, of people through which this virus is circulating and then can leap out of the children and infect the general community. Older folks, immunocompromised folks, people who have really good reasons not to get infected with any type of virus. So by controlling the circulation of this virus in children, it's another layer of protection for the community. And then lastly, what are variants? Well, remember those spike proteins that we talked about, those sticks? It's through the composition or the makeup of those sticks that determines whether it was the original SARS-CoV-2 coronavirus or the Gamma one or the Delta one that we were dealing with for much of last year and currently Omicron. And these sticks have an astonishing ability to rearrange themselves to evade vaccines and our immune system. And every time they figure out a way to do that, because they're survivalists, they want to survive, they want to find a host. And every time we do that, we run the risk of generating yet another variant that could be less harmful or terrifyingly even more harmful. And every single time a virus in someone's body replicates, divides, leaves, infects someone else, and so on and so forth, multiplied millions of times throughout our population, we run the risk of creating one of those variants. And so children right now run the risk of being part of that variant pool, potential variant maker. So vaccinating them and doing whatever we can, whatever in our toolbox to diminish the impact of this virus is critical.
Wow. Wow.
I can say one more thing.
Oh, one more thing. Hold up, Jackson.
The last thing is that children, when they get infected, have to miss a week of school. That's very difficult, not only on the kids, but on their caregivers to find care, daycare or people to cover them. It means everybody's out of school, out of work. This is what we're doing most of the day at work right now, is talking to people whose children are out of school and how to get them back into school and writing notes, clearing them to go back to school. Why go through that when we have a safe and effective vaccine?
You know, the crazy thing about it is in our news, not just now, but earlier in the later in the year, as we were preparing to go back to school, how many parents were upset that when they were talking about shutting schools down again, and how many parents were really upset about that process. You know, and I do remember watching the news and reading information that was provided to us from potential resources, how upset they were. And now here we are battling if we're going to get our children vaccinated to prevent some of the, and not to say that getting vaccinated will prevent you from getting Omicron or prevent you from getting any form of COVID, but the result of it is it's going to prevent your kids from going to school. Is going to stop that process once again. It potentially it can be harmful to your children at some point if they do get the virus, especially, you can help me out here with this, Leslie, especially if they have preconditioned medical conditions. Is that true or not?
Yeah, it is true. We've seen this with other viruses, such as the flu virus, and a common one that causes a simple head cold in adults, but very significant disease in young children. And that's the RSV virus that some of you may have heard about. You know, many people will get one of these viruses and do just fine and recover, miss a few days of work, be on the couch, have to use up an entire box of Puffs Kleenex and get a raw nose. But other people with the same virus end up with a serious pneumonia and in the hospital, on a ventilator, and in the worst case scenario, die. 20 pre-COVID, before COVID, influenza was the virus that was on our mind because 20,000 people die from influenza every single year in this country that don't need to because we have a vaccine. We in the medical community have never said to our patients and the general community that any vaccine is 100%. We know they are not. But what they do is lessen the impact of these illnesses. They do prevent hospitalization and they do prevent death in most cases.
You know, Jackson, as I was thinking about this from a public health perspective, you know, and how these things cause disparities in our community. And I noticed that you had created a rumor log on our website. If you can just mention the website and kind of what this rumor log, how can this rumor log help this community kind of lessen the hesitation to getting vaccinated?
Oh, thanks, Bernard. So, you know, everyone's heard of a myth or a rumor going around about a COVID vaccine or the coronavirus itself, or one of the variants perhaps, or even, you know, a treatment for, you know, this illness. And some of these rumors, some of these myths start as a joke. Some of them are meant intentionally to, you know, cause, you know, a misunderstanding. That would be disinformation. All of this can impact people's confidence in getting the vaccine, and or underestimating how severe the COVID infection could be. And so it's really important for us, you know, working in public health and working in healthcare to, you know, kind of, you know, squash these rumors and myths before they get, you know, widespread. And so while it's very difficult to, you know, challenge misinformation, within the community once it's already spread, if we can stop someone else from hearing that myth and rumor and, you know, making sure that they have the correct information before they encounter that myth or rumor, they are less likely to believe that misinformation that could have serious consequences on people's health. And so one way to do that, we created what we call a rumor log. It's a place where you can report a rumor that you're hearing about COVID or the vaccine. And we will get this out to our partners working in the community, community organizations, organizations like Leslie's and the community healthcare van, to make sure we have information out into our communities. And so that website is www.vaccinate.nhv.org/rumors. And this is where you can, submit these types of rumors.
Oh, wow. And I would encourage you to just check out the website. And if you are hearing something and you're really not sure about it, go on our website and place it on there. And I'm more for sure we'll get back with you just to remove the rumors. And that leads me back to Leslie. Leslie, in your practice, and you're out in the community all the time, working with these babies, has the number increased increased as far as babies and young people, not babies, but young people catching this virus? And why is that? Why do you think the numbers have increased so much versus in the past when they were saying that children and young people are unlikely to get COVID because they were children?
Yes. Well, to answer the first question, absolutely. I would say somewhere between 20 to 30% of our patients who are getting tested that we know of. And remember, we don't know about home testing because those numbers aren't reported in any organized way. Those tests are positive. So that's a huge jump in the number of young people who are being infected with this virus. To answer the second part of the question, it has to do with the nature of Omicron. Omicron is much more contagious than any of the other variants that we've seen so far. That's the bad news. Remember those spikes that are able to rearrange themselves? Well, what they rearrange themselves to be able to do is to get inside our bodies. So I guess what was happening, and I'm not a vaccinologist, a virologist, a person who studies viruses and vaccines all my life, but from what I understand, this virus was frustrated by the amount of resistance it was getting, either by people having antibodies from vaccine or natural infection. So it figured out a way to make itself get past those people who were immune and become even more infectious. That's how it works. The good news is that it turns out that Omicron does not seem, as far as we know, to divide in the lungs or set up its impact, its disease in the lungs as much as Delta did and the earlier versions. The earlier versions caused catastrophic destruction in the lungs, whereas Omicron seems to mostly do its business in our noses, in our throats, and our sinuses. But I am hearing that it causes a terrible sore throat. I actually had a patient have to go to the emergency room this week to get IV fluids because he couldn't swallow. The pain was so bad from his Omicron infection. So that's why. Was there another part of that?
No, that was pretty much it.
That was it.
Yeah, I appreciate the answer. Jackson, how does public health, from a public health perspective, kind of what is your foresight from a public health perspective as it relates to what we've already talked about? Why is public health so important in this pandemic as well?
Yeah, I think the general public has not had this much interaction with public health in the past. When I got my master's in public health, so I'm originally from Oklahoma, and my parents would say I'm in med school because they didn't really know what public health was. And it wasn't until this pandemic that my parents and majority of the country really encountered public health. They had to learn a lot of this terminology that has not been used in the past, and also the healthcare field had to get better about translating medical terminology into language that everyday people use. And so that was one big challenge for the field of public health in general. But as far as things that we are seeing from a public health side in terms of vaccination. In New Haven, only about 22% of children 5 to 11 are vaccinated with at least one dose. And that number is even lower for those that are fully vaccinated. And in children ages 12 to 17, it's roughly 58% have received at least one dose. We really want to see these numbers increase. Just over the weekend, the CDC saw a record number of pediatric hospitalizations due to COVID-19. And so, now is the time, we can't wait any longer. We really need to get these younger people vaccinated, not only to protect themselves and their families, but also our community, because the more community spread of the virus, the more likely that, the harder it is for us to contain it and to protect those that can't get the vaccine. Right now, children under 5 cannot get the vaccine. And so, this is really, the only way to protect these children and people with autoimmune disorders and other people who cannot get the vaccine. The only way to protect them is to make sure that everyone who can get the vaccine does get the vaccine.
Leslie, when you look at your practice, when you are seeing children, kind of what are the questions that parents are asking you, and kind of what was your response to some of these questions when it comes to their concerns about the vaccine?
Well, to be perfectly honest with you, Bernard, the questions have been relatively simple and basic. They call or they wait till they have a scheduled visit to ask a simple question. Do you think my child should get vaccinated? And then I answer yes. I ask if they have any questions about the vaccine. I'll answer it in much the same way I did in our conversation at the top of this call today. And then their next question is, where can I get vaccinated? And that's been a trickier thing. There are many, many places in the city that children can get vaccinated, and more clinics and doctors' offices, I think as time goes on, will come online to be offering the pediatric 5 to 11 vaccine as part of the regular schedule of routine childhood vaccinations. Not all of the offices have done that because the ordering is a little tricky. The storage of the adult vaccines is tricky, not so the pediatric vaccines. It's actually a lot easier, but people are still trying to figure it all out. The problem we're facing in our clinics is nursing staff shortages. So many people are out because somebody in their family has coronavirus that we literally don't have enough people to add an extra vaccination to the workflows that we have in the clinic. But hopefully, at least at Fairhaven Community Healthcare at 150 Sergeant Drive, which is the particular location where I see patients, that's going to be addressed very soon, and we will start administering the vaccine within the next 2 weeks. In the meantime, I know just in the meantime, I'm in conversation with Yale Medicine and Yale New Haven Hospital, looking at ways to do some pop-up clinics like we were doing for adults, but just for children 5 to 11. And hopefully we'll be doing that, in the next month or so. And then the New Haven Health Department, I just have to give them a huge shout out. They have done an outstanding job of setting up vaccine clinics throughout the city in, previously very unusual places, like the public library, like the taco trucks on Long Wharf. And they've been everywhere, on the green in nice weather, at parks, at fairs, offering the vaccines. And everywhere where they are, a child 5 to 11 can get a vaccine.
Jackson, how do we limit disparities by getting this information out to, because Leslie said it very so eloquently, how do we get this information out to the public? Where can they go to get information when it comes to things that she mentioned as far as clinics in this community? Where's good places to get this information where people can just get it at a drop of a dime? Where would you say to that?
Yeah, the city has a website. the COVID hub. If you just Google, COVID-19 vaccines, New Haven, it'll pop up. Also, if you go to vaccines.gov, there's a phone number there that you can text and find a vaccine provider within within a distance that you can change. So if it's half a mile or a mile, whatever distance that you can travel to get a vaccine, you can put that in there and they will help you find one. Also, our website vaccinateinhv.gov, that's .org. I'm sorry, vaccinateinhv.org is where we are listing pop-up sites, any of the pop-up clinics in New Haven. So all these places are where you can get, find where you can get a vaccine. As far as information about vaccines, there are a lot of trusted resources around from, the cdc.gov to, Johns Hopkins, COVID information, Yale Medicine, Yale New Haven Hospital. All these places have information about the COVID vaccines to really, make you feel more confident to get the answers that you're looking for.
Leslie, you also do something that I adore, and because I've been blessed to get hired by Southern, it gave me the opportunity to work directly with you with the community healthcare van. And I've heard that, and I've experienced that you guys, if you're called upon, that you're willing to go anywhere in this community in New Haven to provide this community with multiple levels of internal medicine services as well as vaccines. Could you just speak a little bit more about the community healthcare van team that you have coordinated just a few years back?
Oh, thank you. And thank you for the compliments, Bernard. You really are one of our biggest fans, and your compliments are just really appreciated and taken to heart. But yes, since 1993, the community healthcare van has visited various neighborhoods throughout the city, equipped to provide some basic primary care services to anyone, regardless of insurance or ability to pay. Most, if not all of our work is grant funded to provide these services so that we can include anybody within the area who would like to get services. The particular focus of the community healthcare van is to prevent harm through the spread of infectious diseases and through the use of injectable drugs. So we are particularly interested in testing and treating for HIV, hepatitis C, hepatitis B, and for providing persons who inject drugs with clean, safe syringes so that they do not have to reuse or share drugs that could be contaminated with viruses that cause disease. We can also prescribe something called PrEP, or pre-exposure prophylaxis, for men who have sex with men to prevent the transmission of HIV disease. We're also able to start individuals seeking medical assistance for their substance use disorders with Suboxone or buprenorphine. And we can also treat alcohol use disorders with various treatments and medications. We're also able to screen and link those seeking assistance with behavioral health and mental health concerns with a clinician who can provide treatment and therapy. I think that pretty much covers it.
If someone wanted to get their children vaccinated by the community healthcare van, what are the requirements that a parent would need to do if their child, if you were at a clinic somewhere in the city and they came with their child, what would the parent need to do in order to get their child vaccinated?
Right. Well, right now, because of just the logistics of vaccine handling, we're not equipped to necessarily vaccinate anybody on any given day who walks up to the van with a child, because these vaccines are very fragile. Once you open up a vaccine, you only have a certain number of hours to use it. So to decrease waste of these vaccines, we have found it necessary to, found it necessary to provide our vaccinations within the scope of a designated clinic. So for example, a few weeks ago, we partnered up with Junta on Grand Avenue, and they sent out a message to their community, and we vaccinated, I think, about 10, maybe 15 children along with their parents for COVID. This coming Saturday, we are working with Haven Clinic on Howard Avenue, and we will be providing for their community COVID vaccinations for children. I would say if anybody wants to just today get a COVID vaccine for their child, that they should, I'm so sorry, that they should look at the website that Jackson mentioned at the New Haven Vaccine Hub, and find out where the ongoing vaccination clinics that can accommodate children are located. And they can walk in. Many places do not require an appointment. The train station, I believe, the public library, 54 Meadow Street. I forget the address, but the building, the boathouse on Long Wharf Drive, that beautiful new building.
Yeah.
Yes, on the east end of Long Wharf. That's a place that people can go. The days and the times are all located on that vaccine hub.
Thank you. Thank you. You know what, Jackson, I was just thinking about some things, and I think you're thinking right on the same level with me. Sometimes communicating becomes very difficult for people, for children to be able to talk to their parents, or parents being able to talk to their children as it relates to vaccines. Kind of from a public health perspective, what would you say to these children or these parents in order to find significant ways of communication about this particular matter?
Yeah. I wanted to take a step back and first, make sure that anyone listening, if they are, they have a friend that has children and, they want to talk to them about getting them vaccinated, how to have those conversations. So, with all this, we've coined the term, trusted messenger. Who can people go to get information that they trust? And top of the list are, family doctors and healthcare providers. But, right up there next to doctors and healthcare providers are friends and family who have taken the vaccine. And so it's important to have these conversations, although they may be difficult, to, really get everyone vaccinated and to protect our community. And so, to do that, one, you have to be a trusted messenger to your friend, but you need to help them find their own reason to get vaccinated. And under yourself, you need to understand that their concerns about the vaccine are legitimate. Like, they have concerns and they want to protect their family. And so, you need to be able to express empathy and understand that where they are coming from, that they're just trying to protect their family. And once you have those common, that common ground, you can ask more open-ended questions about their concerns. So instead of telling them that, they are believing nonsense, try to get at the root of what they are concerned about and ask them if it's okay for you to share information. Ask them if you can help them find more information about that topic if you don't, have that information. So I think that's really where to start, is to ask open-ended questions and ask permission to, help them find more information. And, if they get to the point where they feel comfortable and confident in these vaccines, then ask them if you can help them find, a vaccine clinic that's nearby or in the neighborhood. But really, you can't force people to get these vaccines. It's, up to them, and to really help them find their own reasons why it's important for them to get the vaccine.
Well, just listening to Jackson, Leslie, brings me to this question for you. How do you comfort your parents when they have these most difficult moments, being a medical professional licensed to provide medical care for children. How do you comfort parents that may be a little hesitant or frustrated, because we are frustrated to some extent about this pandemic that we're in? How do you comfort your patients and parents? That's a good question. Huh?
That's a good question. How do I do? I think my first reaction is to say that I rely on the relationship that we've built with each other over the years. If it's a patient that I know very well, I think I follow the tips that Jackson just outlined. I listen carefully. I work hard not to be judgmental. I'll be honest, sometimes we hear things that to us sound just really incredible and hard to believe. And we are, very frustrated by the rumors that have circulated and that harm that they've done. But it does no good for us to point that out. So I've learned that lesson. And as Jackson says, help guide the family to a place where they can make a decision that makes them feel confident in what they're doing. And also that not only just confident and accepting it as something that's inevitable, but something they actively want to do. Empowering them to make a choice that makes them feel like they're providing a really good protective medical intervention for their child in the same way that they accept the other vaccines that we offer.
So do you look at yourself as a medical trusted messenger, and people can actually trust in the information that you have provided? Should people really trust the science?
Yeah, that's what I'd like to look at myself as being, but there are some folks who just don't trust doctors or the whole medical community because of concerns that there's another agenda, like that we stand to profit, or that we're working with the government, or that we're working with drug companies, none of which is true, but folks don't know me. They don't know how, in terms of the economics of my job and my profession. I don't know any doctor in my world who operates or out of a motivation for profit or for attention or connected with a political party. That's just not part of our game. Our game is that we wake up and we get dressed and we drive to work every single day, motivated by wanting to provide good health care and healing and protection for the most vulnerable members in terms of pediatricians of our society, and that's young people.
Jackson, I feel the same from a public health standpoint. Do you look at yourself as a trusted messenger when it comes to providing information to the population? And why should they believe the information that you put on your website? Why should they believe the things you're saying now? And this is where hesitation derives from, is people don't trust us. So what do we do from a public health standpoint to help people to understand that this information is actually, as Leslie said so very nicely just now, well, how can we trust the very information from a public health standpoint that this community can really attach to?
Yeah, throughout the beginning, from the beginning of this pandemic, we find information and we get it out to the public, and then we find more information, and that might, update previous information. And so it can be confusing. There's a lot of mixed messages out there. And some of that is on the field of public health, where they failed on communicating or getting this information out. But part of that is also just the historical aspect of it, where, the general public has not had so much contact with science and the medical community. And, that's a problem on, especially on the medical community to, translate that information that's understandable. And so, we in public health and the medical community are really trying to get information out there as soon as we have it and update that information based on the latest data that we have. And when there are so many, so much going on so rapidly, it's hard to keep up and hard to stay on top of those things. But I think, one thing that we all can do is work better on increasing what we call health literacy or science literacy, understanding the core, foundational principles of public health and science, and, really start from there. And so, what Leslie was talking about earlier with mRNA, when we in the scientific community just talk about mRNA and how these vaccines create spike proteins or that our cells create spike proteins that elicit an immune response, that's confusing, especially if you haven't studied, cellular biology. But breaking things down into a form that everyone can understand is really what we in public health need to be doing more of. And I think that will help with some of that trust. If people can, connect the dots and, find the answers themselves with their own intuition, own logic. But it's very difficult to do that when we, haven't given them the tools to do that. As far as, just people in public health, can you trust us as trusted messengers? Public health is not a glamorous field. You don't go into public health thinking you're going to, get rich. I certainly didn't. And before the pandemic, no one really knew about public health. And so often what we say, public health is a silent defender, because you only know about public health is, when we mess up or when there's, something like this, like the pandemic, where we haven't been able to, control the spread of a virus, or, haven't been able to make sure the water is safe. And, all these, various aspects of public health, you don't know about it until, something's really bad. And so, again, I really think that people in public health are really doing their best. I mean, public health is a field that's focused around social justice and health equity, making sure that we are reducing health inequities and disparities throughout our society. And so I would like to believe that we are trusted messengers.
As we know, calls like this have to come to an end, and we have reached that place. What would you say when I say COVID versus our children doesn't mix? What would you leave this community with as a trusted messenger from a medical perspective, and as a trusted messenger from a public health perspective? What would you say to community in your final words in just a few seconds, please? Leslie?
Yes, I would say that please ask us questions. If a doctor or any other health professional is too busy to answer your questions, find another one who will. I will make myself available to anybody who has a particular question, who's listening this morning, and let us share from our hearts the best up-to-date information that can protect the children of our community, who in turn will protect the broader community.
Thank you, Leslie. How about you, Jackson?
Yeah, I would just like anyone listening to think of the vaccine as just another tool that you can use to protect your child. It's just like a seatbelt, a car seat, or a bicycle helmet. It's the best way to protect your child and your family and our community from COVID-19.
There is no better two people that I would ask that's what I'm so equally happy about, that we're able to come on a call today to help you realize how important this is. Thank you, Leslie. Thank you, Jackson, for both of you coming on the call. And I'm hoping that you out there in the community are feeling just a little bit better, because this is real. and it's not going anywhere until we all take the time to get vaccinated. The vaccination is the key. Don't put your children at risk because you're not educated enough. We've given you some places to go.
As I got another rhyme, another rhythm for y'all to listen. I'm never quitting on my mission. I'ma roll with what I'm giving. Got some ambition, this new edition, filling positions. Looking at the void in myself and feeling what's missing. Better watch the way you going, better go in the right direction. In the moment you stressing, but you gon' be counting blessings. And I know that for certain. Keep on working, open curtains, haters swerving, cause they ain't ready for
This
your
is
final
Harry
version.
Drills, and you're listening to WNHHLP 103.5 FM New Haven.